Thank you. Now, what I'm going to cover today is an overview, and I'm going to give you a lot of information about about a naturopathic toolkit. So the first thing is I'm going to cover some homeopathic basics, how you would prescribe homeopathic remedies. Then I'm going to look at some immune support that can be really useful, and I've given you a list of supplements that would be helpful, a couple of key herbs and some teas. I'm also going to look at some common issues with managing health. And, basically, I always want to make sure when I'm teaching a first aid course that people are clear about when they should treat it themselves and when they should actually go and seek advice. So I tend to be a little conservative about that, but if you can just bear with me, I, really try to make sure that you know when it's safe for you to treat and when you should actually get someone else to give you a hand. I'm going to look at about half a dozen homeopathic remedies that can be really helpful for prescribing. And also I've got a list of resources there for you for following up. So some useful books, some sites, some other, if you decide this is really interesting and I want some more information, this is where you go. Okay, so if everyone's good with that, first up, I just want to look at, really what is homeopathy? And there's three key principles with homeopathic medicines. But really, the first thing about homeopathics is it's come out of herbal medicine. The difference is these are really dilute medicines, and it's about using the absolute minimum amount you need. So hence, law of the minimum dose. It's also selected on basically being similar. If you took the homeopathic medicine, it would give you similar symptoms to what you're treating. So what it causes, it can treat. Now, really, that's a little bit of an interesting concept. So let me give you an example. If, for example, you had 6 cups of coffee before bed, how would you be? Chances are you'd be quite excited, agitated, unable to sleep, thoughts racing around your head. Well, we'd use a remedy from coffee called coffea, and we'd probably use it in I'm just trying to see that this comes up, like little pilules or liquid drops, quite a small dose for someone who has trouble sleeping because they feel as though they've had a lot, they're really agitated, they feel like they've had a lot of coffee and their head's racing with thoughts. So basically what it causes, the symptoms it causes are what it treats. Now, homeopaths are all a bit nuts, and I hope there are no other homeopaths on the call, but this is the reality. They're all a bit nuts, and often, we're in a situation where we try these remedies to see what symptoms we get so that we know what to treat with them. And there were a group of predominantly men who did this about 250 years ago and proved up initially about 50 herbs, and then they expanded it to a whole bunch of other things. So there's remedies made out of minerals and animal products and all sorts of different things. So it's a really interesting way of treating. But the other thing about homeopathics is they're very, very affordable, and they're often used in countries where incomes aren't very high. For instance, in India, it's one of the biggest users of homeopathic medicines, and they actually have hospitals where you can go and you can be treated both conventionally and with homeopathy. Now, when you're taking a case with homeopathy, it's really important to match the remedy to the case in front of you. So it's a little bit different to case taking normally, because normally if someone, is unwell, you say, what's wrong? And they'll say, I've got a headache and it hurts. And you go, okay, here's a name brand, Panadol. Now, you can't always do that. You can't do that with homeopathy because you need more information. So there are a few areas we tend to focus on. First thing is sensation. What's the pain like? And then where is it? And usually what I find is best is tell people to point to it, because often what they say, I have a pain in my throat, is it here or is it down here, which is more in the chest? So make sure you're really clear about where it is. The other thing that can be helpful is to know what makes it better and worse. Now, often with this, which is what we call modalities, it may be a bit unusual. So for example, with some of the cold remedies, there are people who really become very sensitive to temperatures. So when they have a cold, the slightest draft makes them irritable. So, and with other ones, it can be, they're like a bit like a thermometer. There's like this really small range of temperature where they're comfortable, but otherwise they're too hot or too cold. We also look at whether, and I'm going to jump around a bit here, causation. What was the trigger? What brought it on? So one of the remedies we use a lot, aconite, is for ailments that come on from being in the cold. So it's literally like, I was at an event on Sunday night, I got really chilled, and the next morning I woke up coughing. So that came on because of that exposure to the cold. That was the trigger. So basically what I need to do is take the aconite as soon as I realize that was happening. Sometimes it's not always, you don't always get it early enough. And then the last part of this is a concomitant, which is a symptom that occurs at the same time. So for example, you know, if you've got a headache, you may also have a fever. So you go through the same process that you did initially with the case taking. So that's just a little snapshot of case taking. I was going to say, with my students at college, that's usually about a 4-hour lecture. So you've been just given the real highlights of it. All right, the other thing with homeopathic dosing, I'm actually going to come back to this because really what you need to do is prescribe based on the situation in front of you. So if someone's just fallen over and they're all bruised and shook up, I might use a remedy called arnica, and I give it to them really often. Like I give it to them every 10 minutes until they've settled down, which might be, you know, 3 or 4 doses. But normally with a cough or cold or a stomach ache, I might give it 3 times a day. So you can see how you would prescribe based on, you know, it's an injury that's just happened, or it's you know, it's something ongoing like a cold or a stomach upset. And typically what I do is I stop on improvement, but I would say stop dosing when there's good improvement, not just a small amount of improvement, but, you know, a really significant shift. Because with homeopathics, we're going back to that minimum dose. It's as much as they need and no more. Now, I'm just going to have to stop screen sharing for a second and just check. Oh no, I don't think there's anyone else in the waiting room. I think we're okay. All right, so the other thing is, you know, if you find that the symptoms have improved during the day, but the next morning they're back again, then you just repeat the same medicine. If you've used a homeopathic medicine for a couple of days and it's not really making any change, go back, reassess, see if there's something else that's better indicated. So with a colleague recently, she had started taking a remedy I'd given her before for a sneezy cold, but she actually had more of a sinus condition. So I needed to change the medicine, and she had really good improvement in the first 24 hours because we went to something that was more appropriate. All right, so we're going to look at some therapeutics now. Okay, I can. Hi, I've just let you into the seminar. So if you can just put your mic on mute, and we're just covering off on some basic immune support. Okay. Excellent. All right. So I've written a list here of some basic immune support that I would recommend. And what I would say is that, you know, you don't use all of it. We need to tailor it specifically for what's in front of us. So what I'm going to cover off is, what would you start with initially, depending on the situation? So if it's more of a cold or an upper respiratory tract thing, so like, you know, you're coughing or like a bronchial condition, then what I would start with is supporting the immune system with things like up to, well, actually, more vitamin C than this. I usually, if I've got a cold or a cough or a sore throat, I tend to go in quite high dose with vitamin C. But it's really important with vitamin C that you will pee out the excess. So what it's really important to do is make sure that you split it up over the day and you take smaller amounts more often. So I would say have 500 milligrams 4 times a day, in preference to taking 2 grams in one dose. And the reason I suggest that is because, frankly, with that, if you take it all in one dose, you may tend to hit bowel tolerance, and that's not really that pleasant. So what we want to do is support the immune system and not create another symptom. Okay. Now, the other one that's really important for the immune system when you're sick is zinc, and I usually like about 25 milligrams a day. Again, zinc is quite a big mineral, so make sure you take it with food. because if you take it on an empty stomach, it can make you feel quite nauseous. And then I would also look at, if I feel like I'm getting sick, I go with quite a high dose of vitamin D at night before bed, and often that results in some good improvement. And I was going to say, with the current virus that's circulating in the Victorian community at the moment, I usually recommend that everyone is taking through winter 1,000 to 2,000 IUs of vitamin D a day, which is usually about 1 to 2 capsules. Now, if you're worried about taking supplements longer term, get your doctor to check your vitamin D levels, and then you know whether you're at a decent level or not. Now, usually they say deficiency is below 50 nanomoles per litre, but I like it up to 100, so for good immunity. And if you particularly are prone to lots of colds and flus, that's about the level you get it up to. Now, the other thing I would recommend, and particularly at the moment, is you look at something like, well, I've said probiotics here, but I'm actually looking more now at both prebiotics and probiotics. So I've got a really good blog on my page, which is Christine Pope Nutritionist, about prebiotics. So prebiotics are basically fibers that feed beneficial bacteria in the gut. So if you really want to support your immune system longer term, that's what you need to be doing. And really the easiest way to do that is 3 cups of vegetables a day, but you want variety. So it's really important to kind of eat the rainbow. And I would say, like, ideally 1 cup of green leafy, 1 cup of coloured, and 1 cup of your brassica vegetables, which would include things like cauliflower and Brussels sprouts and cabbage. So just, make sure that you're eating that variety. There are prebiotics you can buy, but the best one I found for supporting the whole gut bacteria is actually called PHGG, which is partially hydrolyzed guar gum. It's not easy to say, but that's actually been shown to be really good at supporting the beneficial strains of bacteria in your gut. Now, that's what I'd actually do if I was at the start of a cold or a sore throat or a flu. The other thing is, once symptoms start developing, I would also look at a really lovely product called Sambucol, which is actually in pharmacies and health food store, and it's a beautiful purple lozenge or capsule, and it's made out of elderberry. And the ones that are for sale actually come with, I think, elderberry, vitamin C and zinc. So it's a really nice combination. The thing is, I don't know if you've ever had brand name Codral, but those lozenges tend to make you feel a little rubbishy afterwards. They don't have a great taste. The elderberry is actually beautiful and tastes really nice. In fact, you've got to be careful with the elderberry because the kids really like it. And so you might find that they're sucking away on the lozenges when they're not sick. So just watch what happens with that. If you're actually really, if you've got a really choked up cough or cold, the other thing I really like, there are a couple of teas. One on here is called Yep, which is yarrow, elder, and peppermint. It's really soothing for coughs and colds. And you can often find it in like health food stores, or I've also seen it in on the drive on the way down. There's a beautiful tea and jam place, which is called Mrs. Oldbucks. It's in Berrima, and they have a whole range of these teas that you can buy. And she's also online, so you could check it out there. But if you don't have the Yep tea at home and you're feeling miserable, the other two I do is either a garlic and lemon tea. So what I do is I take a whole lemon, and preferably organic, or scrub the skin quite well. I quarter it up, I put it in a pot, cover it with about 2 litres of water, and I put 5 cloves of garlic in. So you can imagine this is going to taste amazing. I boil it for 20 minutes. And I make sure I boil it with the lid on, because that keeps all the beautiful oils from the peel, the limonene, into the water. And when I serve it, I usually serve it with Manuka honey. And the reason for that is the lemon and garlic can be quite acrid. So if you don't want that sort of taste, then add the Manuka honey. And a Manuka honey with a good UMF factor actually can be quite therapeutic as well. So it can be really nice for the back of the throat. So a teaspoon of that as well would be the sort of support I'd suggest. Now, In terms of immune support, because we're going to talk a bit about stomach upsets. In terms of immune support for stomach upsets, I would also look at, sorry, I did put this out. Here it is. A called, this is a bottle I've got here, which because I always travel with this in case I have a tummy upset while I'm traveling. It's called, this one's called SB Pro, but I think the over-the-counter version is one called SB Fluoractive, which is made by Bioceuticals. And it's a prebiotic fiber, but it tends to bind to problematic bacteria. So if you've got a really bad tummy upset, you can take 2 up to 3 times a day, and it usually reduces the intensity and the duration. So this is something I was introduced to for traveler's diarrhea, but as a non-gluten sensitive, non-celiac gluten sensitive, I've actually found that it's really good if I accidentally get gluten too. So that's just a little bit of a tip from that perspective. Now, we've covered a fair bit of information, so I'm just going to stop screen sharing for a minute and just check and see, did anyone have any questions they wanted to ask about that first stage? Do you want to put your mic on? Brilliant.
Hi. I just wanted to ask you, you were just talking about the stomach supplement you can use if you're having digestive problems, and one was SB Pro. What was the other one that you say is available?
Okay, it's called SB Fluoractive. Active. I'm just popping it in the chat box so you've got it written down. Can you see that one?
Okay.
Yep.
That's,
that's a Bioceuticals brand. And in terms of, if I'm buying supplements over the counter, I like Bioceuticals, which is made by Blackmores, because they make a lot of it in Australia, and actually they make it down at Warriewood, which isn't far from where I live.
Right.
So I know that it's a clean, safe product. And if you can't get hold of a practitioner product, that's a really nice option.
Okay. The other thing I wanted to ask you about elderberry.
Yep.
I'm growing elderberry, so do you actually use the flowers or the leaves to make the tea?
The flowers and the berries are both able to be used and have a slightly different immune response, but you know, there's no reason you couldn't use either. I'd probably use the flower more for the tea personally.
Yeah.
Because otherwise it just, it's a bit tricky with the berries. But you know, there's an elderberry syrup. There's another practitioner called Kira Sutherland at Uber Health, and she makes her own elderberry syrup for coughs and colds. So have a look at her Facebook page, because she's got instructions on how to make the syrup from it.
All right.
And I think it's something that would work really well for you.
Okay. Now, this is something you haven't touched on, but I just wanted to know, is it still possible to get comfrey? And comfrey is commonly known as knit bone, isn't that?
Yeah,
is that right?
I'm actually about to talk about arnica and those acute remedies, but comfrey you cannot use internally.
Yeah.
You can only use topically. So you could grow your own, but you can't use it internally because there's been some issues with toxicity. But there is a homeopathic form of it called Symphytum, which is really good for fractures. So remind me at the end and I'll put in the instructions for how you use that.
Yes, I'm just about
homeopathic made from Symphytum is the Latin name for comfrey.
Okay, so I'm interested because I'm just about to have an operation where a bone has to be cut and repinned.
All right, so you need this, but I'm just typing it in the chat. You need homeopathically once a day for 2 weeks, but only after the swelling's gone down. Okay. So it will support the healing, but you don't want to heal when you're still puffy. You want to do first, get your swelling down. In fact, I'm going to that now. So let me just
all right.
That bit.
All right. Thank you very much.
And I love the fact you're growing your own elderberry. Made my day.
Okay, great.
All right, I'll just go on to the back onto the arnica. So I was going to talk about a few injuries and trauma remedies, and fabulously, Linda's reminded me about another one that is really good to use for fractures. So the first remedy to think of for falls, sprains, or strains is arnica. And arnica was also from a herb called bruisewort. So that probably tells you what it's useful for. Generally, it's also for whenever you feel sore and bruised anywhere in the body, but particular affinity for muscles. And I was going to say the sore and bruised could also be that I've overdone it at the gym, or I've had a really hard massage and I feel bruised, but you know that in a day or two that'll have ebbed and you'll feel better. But the arnica will help the bruising at that point. So if I've had a really strong massage or I've overdone it at the gym, I'd probably take it 3 times a day. But after a fall, it's also quite good for the shock. And often people who need arnica have this particular picture where they fall over and, I did this once and I was really embarrassed. I was at a really good restaurant. I fell up a stair, ripped my toenail. I won't go into any more details, but I was so embarrassed. I'm like, I'm fine. Just leave me alone. I'm okay. Just, and that's the thing often with arnica, the people won't realize that they've actually injured themselves and they need help. So they'll be like, no, I'm okay. And you just have to kind of go, no, Christine, you're bleeding. You need to do something about this. Just come over here and we'll sort you out. So yes, there's also this kind of emotional picture with this remedy, which is they kind of go, I'm fine, and leave me alone. So arnica is probably something that I think every parent needs, because consistently kids are always, running into things with their heads or their knees or falling over. And it's a really useful thing to have in first aid kit. The other thing I really like, and it's more of a topical treatment, but again, it's that do something, mum, and I'll feel better, is Traumeal, which is made by a company called Heal, but distributed through Brower in Australia. And it's a combination of herbal and homeopathic ingredients, but it has the arnica in here, but also with some other things that are really synergistic. And they make it in a gel. And the best thing about the gel is if you're sore and achy, like I often find I get to clinic and I've been hunched over a computer, the shoulders are a bit sore, I can rub the gel in and it absorbs really quickly. Whereas with a cream, it can be sticky and it sticks to your clothing. So have a look out for the Traumeal gel. That's a real winner. I think Brower also do an arnica cream called Arnica Ease. So that would be the other thing I would look out for. Now, if you've got more of an injury to a nerve, and that would be when you've got sharp shooting pain, but I suppose the best instance I can give is if you've ever jammed fingers in a car door. Hypericum is known as arnica for the nerves. And in the case of a fracture or a surgery that requires a bone to be broken, Symphyton is comfrey in a homeopathic form. So it's very dilute, but it's really good for healing fractures. And usually what I would do is if someone's had broken a leg, I would get them to take arnica until the swelling's gone down, and obviously make sure they've had it set at the hospital and done properly, because we don't want to have long-term ramifications. But then once the swelling's gone down, I would actually get them to use Symphyton in a 200C once a day for 2 weeks, so that I know that they're healing properly. And I had someone who had a break through his femur and it went through his growth plate, and his surgeon was so impressed with how well it healed with the Symphyton. So it was a really significant break, and also a very good reason not to play rugby. Anyway, the other ones I wanted to mention were more about sprains and strains. And typically with sprains and strains, I've used the arnica at the first stage, and then depending on where the injury is, so this is coming to the location, I'd use either Ruta or Roost Tox. Now, Roost Tox is probably my first preference, and that's where, they're really stiff, but it's what I call the rusty gait. So I'm going to give an example, and I hope the camera can catch it. So you kind of get up from the chair, and it's like, oh, but I'm going to have to move back here. And then, oh, I'm stiff. But once you start moving, you're okay. So Roost Tox is kind of good for that. They're better after they start moving around. Generally, they're better also for keeping it warm. So they may be the people who want a heat pack on it. Whereas with Ruta, people tend to be more fatigued. So they're the two remedies you would often use for sprains and strains. Personality-wise, both of them, they're very similar remedies in the symptoms, but I have found Ruta is more specific if you've got an injury to like a shin or something where there's not much of a covering and it's really sore and painful. So they'd be two I'd look for. Now, typically, what I suggest is if you find homeopathic medicines, if you found this is interesting, there's a company called Martin and Pleasance that do these first aid kits, and they have about 20 different remedies in them. I have them in clinic for my clients, and they're $90 for 20 remedies, whereas normally I dispense more like this, which is probably a bigger size, but to have a first aid kit can be really handy because you've got a whole group of remedies there you can use. However, Linda, the symphytum is not in that remedy, so you would need to get that separately. All right, so what I want to go on to now is just talking a bit about management, because I'm going to go to some specific remedies for fevers and colds and things, but I just wanted to cover a few basics. And look, I'm sure most of you are familiar with this information, but I always find it's good to have a bit of a refresher. So first up, fever. Fever is normally regarded as an increase in the body temperature above 37 degrees. Most people, it depends on what you're like. Some people in the morning will have a lower body temperature. And if you've got a slow thyroid, it could be down to 35.9. Some people will run a bit hotter and they'll be around 36.5. So it's different for different people. But, I always found the mum thermometer worked quite well. The hand on the back of the forehead, you could usually figure it out. But I think it's a good idea in a first aid kit to have a basic thermometer and actually know where they're at. Because realistically, I don't want anyone running, if anyone's running a fever of over 40 degrees, I think you need to treat it as an emergency and treat it effectively. So, and especially with small children, if they have high fevers, it can trigger convulsions. So I just wanted people to be aware of that. I've actually dealt with convulsions with my younger sister on one occasion, and it completely freaked me out because I had no idea what was going on. But, just from a practical perspective, when someone has a fever, you don't need to overheat them. You actually want to keep less, so, dress them the same way you would yourself. You might use a tepid sponge. Don't put ice or cold on them. That's actually going to create more shock, and the body will heat up to respond. So tepid, and get them to rest. And, I go with this is showing my age, DVD diet. Maybe I should say it's now the Netflix diet. Just let them stream and lie on a couch where you can keep an eye on them and watch, their favorite show and rest. But if the fever's above 100 degrees, I usually recommend that you do use Panadol or Nurofen or whatever you would normally use to get that temperature down. And if it stays consistently high for more than a day or two, you should get them to a GP on emergency route. And that's for you as well, not just for the children. Now, there are a few useful remedies for colds and flu, but really at the first stage, it's usually treating a fever. That's often the first symptom that comes on. Sorry, I'm just getting a bit croaky here. So going to the black tea. That's probably my best option for feeling slightly off in the stomach too. So the useful remedies here are aconite, belladonna, ferrum phos, and chamomilla. But there's also a remedy that they market in the US called Flu Stop, but its full name is oscillococcinum. So can you see why they call it Flu Stop? Because it's a real mouthful. But if you can if you've been around people with the flu and you're feeling a bit off, if you can get onto this early, it can ward it off. And I have actually used oscillococcinum on 2 occasions to stop myself getting a flu, and then supported the immune system to avoid it developing. So I can say it works really well. And it's certainly something I'd like to have in the first aid kit. Now, with the homeopathic medicines, as I mentioned, there's a whole bunch of symptoms we prescribe on, and I'm not going to go through everything in the PowerPoint. I just wanted to give you that information. But basically what we've got with aconite is this is a fever that comes on really fast, and literally like a child or an adult could be outside playing in the cold, come inside and they throw a really big fever. They're red, they're hot, and often when they need aconite, they're very distressed and they tend to be a little bit dramatic. They think they're going to die, basically. You know, everything's an emergency and a catastrophe. So they're very, very anxious. This can also be a great remedy for the first stages of croup in children, if there's a fever there as well. So, you know, with aconite, often it comes on after exposure to cold, but it also tends to come on after midnight, which I think is really distressing at the best of times because you've just gone into a deep sleep and then you wake up feeling really sick or feverish. So that's one to think about for ailments that come on really fast. And I differentiate that with belladonna, which also comes on really quickly, but tends to be more red. In fact, classic belladonna, the first time I ever used this remedy was with my son. And I'd been to see my naturopath, and I looked shocking because I've been up all night with my son with an ear infection, and we've been at the hospital, we've been at the medical center at 2 o'clock in the morning because it always comes on at 1 o'clock in the morning. And he'd had this big red ear and a red cheek. And that's very, very classic that they have one side or one ear that's red, and the other one can be pale. And he was really distressed. And interestingly, so I told my naturopath about this, and he said, here, and this was the first time I'd used homeopathy, try this next time it happens. So sure enough, the next time he had the ear infection at 1 o'clock in the morning, I gave him a dose of the belladonna. I sat there and watched him. I gave him another dose. He rolled over and went back to sleep. Meanwhile, of course, being the sort of mother I was, did I go back to sleep? No, I sat there and watched all night because I wasn't sure that he wasn't going to wake up screaming at some point. Anyway, he was fine. And I found I used the belladonna 1 or 2 more times with him, and then it was good. So it was interesting to see how the remedy could really shift that situation. The other thing about belladonna is it is known, it used to be used by Italian ladies to make their pupils wide. And often when people need it, they can look like, you know, the pupil is quite dilated. So that black bit in the center of the eye. And, you know, the fevers with belladonna tend to come on and disappear quickly. But I often find you get an afternoon increase in fever. So if you think they're okay in the morning, just watch them in the afternoon because often it will jump up again. The other thing with belladonna is, and you know, some of these symptoms are in the times pre-Panadol where fevers could have got out of hand. They can be disposed to bite, kick and punch people when they're sick. And often we'll have dreams that are quite, you know, almost hallucinations. They're really, really out there a little bit. And often children who need belladonna can be, you know, they're the kids who've kind of got what they call an angel on one shoulder and a devil on the other. You know, they can be very mischievous kids. So when it's well indicated, belladonna can be really useful. But the other thing about belladonna is it's really good for any sort of itis. So itis is normally inflammation. So redness, swelling, inflammation, think belladonna. And particularly if they're telling you stories about amazingly weird and wacky dreams. You know, because often, I don't know if you've ever had that sort of fever dream, they can be really bizarre. Now, if the case that some people get very slow moving fevers and things come on, they don't come on as fast. So ferrum phos is kind of the remedy for something's developing, but I don't really have any clear symptoms. And that can be, so it's the first stage of any sort of fever, but also catarrhal, as in anything with mucus. And generally, you know, there's no real clear pathology with this, but you may find they get the chills. So often with fever, you will get this pattern where you get hot and then you chill down. So apparently 1 o'clock in the afternoon is often a time when they will get these chills. So I would say aconite and belladonna are probably your go-to for fever remedies, and ferrum phos is the one when you're really not sure what's going on. And often people like to use it in a tissue salt. which is like a nice little crunchy pill, and it's usually from a lactose base. And you can usually find those in health food shops quite easily. So just recapping on ferrum phos, it's useful at the start of any sort of illness. Often there's a bit of change in colour, and it can be useful for post-operative complaints. So you might want to write that one down too. And kind of the key indication is that there aren't any clear indications. Now, the other thing I will do with fevers is I will often put a combination of aconite, belladonna, and another remedy called chamomilla in a bottle for my mums, and I call it fever mix. And because it's like often when this happens, it comes on at 1 o'clock in the morning, you've got no idea what's going on. You don't really want to sit there and go, where are my notes from Christine? What do I use? You just go to the ABC mix, and whichever remedy the kid needs is what they'll, will be effective, and the others will do nothing. So you can use, I would suggest making up what I call the fever mix, and it's aconite, belladonna, and chamomilla. Now, I'm just going to go back and check and see if there's any questions in the chat. Doesn't look like it. Did anyone have anything they wanted to check on from that section? You might need to come off mute. Sorry. That was good timing. Jennifer's just joined us, and I was just asking if there was any questions about that first section. Oh, Anne was asking about my fever mix. So it's aconite, belladonna, and I'm just typing this in the chat box for you, and chamomilla in a 30C potency, which is the usual first aid potency that you get. And usually I just make them all up in a little bottle, and I have it handy. So thanks for checking, Anne. All right, were there any other questions? Just see, okay, Anne's got that, great. So I'm going to go on now to look at some more cold and flu remedies. But the interesting thing with homeopathic medicines, they can be used for both. They actually are effective for both for a multiple range of symptoms. You just need to know what you need to use them for. So the first one I wanted to talk about was one called Nux vomica, and I put a picture of the tree that it comes from, but it's basically a nut. And it's often used for things like constipation, particularly the type of constipation where you can have a bowel motion. Sorry, naturopaths always have to talk about bowels, it's like a rule. And you have a bowel motion, but you never feel like it's completely empty. So you always feel like you never quite empty out. It's never quite full enough. So it's that sort of constipation. It's also good for snuffly colds. So, and the point which I would use Nux vomica is when someone's had a cold and they're at the end of it and they're sort of irritated and they've got a postnasal drip that keeps making them cough. And, at the moment, nobody wants to cough in public because everyone will think you have coronavirus, and that would be really bad. I actually think the reason we had, and sorry, apologies for language here, but I think the reason we had such a shortfall of toilet paper at the start of all this was because one person coughed, everyone else got the shits. So, it is, it's not good coughing in public at the moment. And, most people, when I've heard them cough, they go, it's allergy. And this is actually quite a good remedy for allergies. It's got a range of uses. And the other thing that I really want to mention was it is really useful for when you've overindulged. So when we were studying, it was known as the hangover remedy. So, this was the remedy you used if you've been out and you had a big night, you had too much to drink. But it's also other sorts of overindulgence. So if you've had rich food or food that doesn't agree with you, so many years ago when we could travel, I was in Italy with a girlfriend and she had a very fragile stomach. And we had this amazing meal with wild mushrooms and boar. And she woke up the next morning feeling terrible because she wasn't supposed to have pork, and, you know, the mushrooms weren't great for her either. And so I went into the village and found her some Nux vomica, because it was that overindulgence in rich and fatty foods that really didn't agree with her. And she came good quite quickly. So that was good. Although I had a hilarious time trying to explain to someone in Italian, which I don't speak, a homeopathic medicine I was looking for. And after they'd laughed at me, I ended up just writing it down. And then they went, oh, and said something completely different to how I thought it sounded. So Nux vomica is one that I find is really useful. The thing about Nux too is that it does tend to be good for people who are really oversensitive. So it could be noise or touch or smells. It doesn't just have to be food. And they're often quite chilly. And it's also good for people who are really focused on work and perhaps aren't looking after themselves that well. So, you know, Nux vomica is a really useful one to have in the first aid kit. It's got a range of uses. And I was going to say the other thing that it can be very helpful for is if you have, I had a baby who had inhaled some meconium and had basically a constant cold for 10 weeks post-delivery, but with just like a constant snuffly, no coloured mucus or anything else, but just, I think their respiratory tract had just been affected by it. The Nux vomica cleared that up quite quickly. So that was really nice. So very useful for that sort of thing. Now, I'm just going to check quickly. All right, I've got 13 minutes left, so I better move a bit faster. But the other really helpful cold and flu remedy is pulsatilla. And pulsatilla tends to be used when it's more infected, really. It's like a yellow-green discharge. And again, I wouldn't, if someone's had greenish discharge for 3 days, that's a case for antibiotics, and you need to go and get further assistance, okay? You don't want to let that run because it could get more serious and more infected. The other thing that pulsatilla can, so with pulsatilla, it's often that morning where you blow out lots of yellow or green mucus, and then by the afternoon it's clear mucus. So the symptoms in pulsatilla switch around a bit, and it can be a bit confusing because in the afternoon you might think, oh, it's Nux vomica. Then the next morning you're like, oh no, it's pulsatilla. If you're getting confused and it's switching around, it's probably pulsatilla. And the other thing that pulsatilla is really good for is because often with kids they get ear problems because all the mucus builds up, and these are very fine passages even in adults, but in children they're very small. So chronic otite, that glue ear, pulsatilla with a low dose of Calimur. So Calimur in a tissue salt in a 6X, that can be a really good treatment for chronic glue ear in children, and often helps them avoid other things like grommets, etc. Pulsatilla is also really good for that. You know, if you've got that mucus and it's really built up, that's sinusitis as well. Now, I've just given you a bit of a summary here. But pulsatilla is also known as a remedy. Often the children who need pulsatilla are very sweet and they want mum and they want attention. So as an adult, you may not necessarily want mum, but you want someone to be there and look after you. So a little bit more needy when you need that remedy. The other thing about pulsatilla, which is really quite interesting, is often, even though they've got a really bad cough, they have no desire to drink. In saying that, I now want to drink water. So clearly I don't need pulsatilla, but they have no thirst. They really can't cope with fats. And if they are prone to constipation, it's like no two stools are the same. So it's interesting because it's made from this beautiful wind flower, and literally, you know, a flower has to adapt in the wind, and these and pulsatilla is a little bit like that. It just keeps moving around. So pulsatilla is one I definitely think about when you've got more of an infected cold or bronchitis. And that's just a little bit of a summary of some of the keynotes with pulsatilla. Now, because I've been treating a lot of sinus and coughs lately, the other one I want to mention is one called Hepar sulf, which is HEP sulf, as in sulfur. That's also really good for more when you've got late stages of croup or a really barking cough and yellow mucus. So in that case, I find the heparin sulf can be really useful. And the thing with heparin sulf is they're very chilly and they're very sensitive to drafts as well. So there's a couple of other things there that can be useful. Now, just in terms of the resources, I wanted to mention first up my Facebook page, because I put a lot of I've written a lot of blogs and I usually post them online. And there's over 100 blogs with lots of information about how you can support your own health naturally. I've given you, I also want to mention that you could order, if you decide, look, I really want these remedies, there are a few pharmacies you can access them from. Either you can ring them up and order them. There's Similimum in Wellington, which is in New Zealand, but they're staffed by homeopaths and they're really good. So I often ring them up just to have a chat and see what exactly I should be using. There is Nelson's Pharmacy in town in Sydney and Martin and Pleasance in Victoria, but you can only order by phone from Martin and Pleasance, whereas you can actually go into Nelson's Pharmacy if you're in Sydney. Now, I would mention this first aid kit. It's $90 from Martin and Pleasance, and I also have them for sale if you happen to be in Sydney. But otherwise, you can order them from Martin and Pleasance online, and it just gives you. Look, mine's a bit old because I've been using it for years, but they usually give you a little prescriber in there as well, so it just gives you a bit more information. The other thing I want to mention, there's this fabulous book called Homeopathic Self-Care. It's written by two homeopaths and naturopathic doctors from the US, and they wrote it for their clients because they treat a lot of kids who are on the spectrum, and they found that the homeopathic treatment would be really effective, and then they'd have another antibiotic or other drug, and it would stop being as effective, and they'd have to do more treatment. And he put the book together to help the parents treat the kids naturally. It's available from Amazon, and I've also found copies from Booktopia. I used to stock it in clinic, but I've now found that Booktopia will have it for about $25 and people can get it cheaper from there. So that one, if you're interested in homeopathy, I think is fantastic. It gives you really good information and it makes it really simple to prescribe. And of course, I've included my contact details there, but it sounds like we've got people from all over the place. So I'm not sure that any of you will be popping into my clinic at St Ives or joining me for a cup of tea at my local at Patterson. So what I might do now is I might just go back and see if anyone has any more questions. Hold on a second. Lost my, oh, there we go. So did anyone have any more questions about that? Any of the things I've covered or anything else they wanted to ask about in terms of naturopathy or homeopathic medicines? Linda?
I'm just wondering, in the case of animals respond to homeopathics as well?
They do, and they respond beautifully. I don't know where you're based, but there are a couple of homeopaths who do practice with animals.
Yeah.
There's a lady called Diana Capazzi who treats a lot of animals. And I mean, it's important that when you treat animals, they're also under the care of a vet as well. But yeah, I've used a few remedies with my own animals. I don't tend to treat other people's animals so much because I don't have enough knowledge about pets and their physiology. But there are some good prescribing books. There's a wonderful vet who does homeopathy in Western Australia called Claire Middle. And she's really good. And she's got a lot of great resources. I actually heard her speak about diet for animals with skin problems. And it was really interesting because getting them back on a raw food diet, she said, would sort out about 70% of animals' skin problems. So I thought that was really good. So yeah, there are a few who do that. And look, I've treated my dog's kennel cough and the pulsatilla. You know how I said they can be needy and clingy? Well, my puppy was one of 11. And when she first came to our house, she was really upset and she had to be with someone all the time. And my son was actually sleeping down on the couch to be with the dog. And after the third night, he's like, oh, is there anything you can give the dog? Gave the dog pulsatilla and she happily slept by herself.
Yeah. Oh, okay. Because I know that some things you can't give to animals. They're they've got a very different system. It doesn't always work. So we've got a couple of dogs, and one of them seems to have an allergy to grass. Every time we take her out on the grass, she gets a stomach rash. So we've been
a golf course?
Sorry?
So near a golf course, because it might be what they're treating the grass with rather than actually.
No, it's not near. We're not near a golf course, but we have at this point been treating her with baby nappy rash cream, which really helps.
Well, it's a rash.
Yeah, but I'm just wondering if the pulsatilla would help.
I'm not sure about the skin rash. I'd need to look at it more specifically. But look, what I might do is pop the names of a couple of practitioners up.
Okay.
With those sort of symptoms, you need to prescribe specifically.
Mm-hmm.
So I've just popped that in the chat box. But there's who practice. And look, I'm sure in this day and age they all do online consultations.
Yeah.
And I've had a couple of questions here and a couple of thank yous. So we do online consultations. I'm on Zoom. I just need to set it up via email. So it is possible. But I'm very happy to see people in person. And the other thing was there's a couple of questions about whether the recording would be available. We're actually going to put the recordings of all the presentations that get done during Natural Medicine Week, and someone manages to remember to record them. That's the other bit of it. We're going to pop them all up on the Natural Medicine Week website. So there should be a range of options there for you to have a look at. All right, well, if there are no more questions, can I just say thank you again to everyone for attending. I hope you got some useful insights out of it, and happy Natural Medicine Week.